Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, as the continent sees a massive spike in the number of recorded coronavirus cases, there's concern about Madagascar's efforts to control the spread of the disease. The president has endorsed a herbal so-called miracle cure that's now being handed out door to door. Also, face masks will be obligatory in Burkina Faso from the 27th, but they're still hard to come by for even medical staff. One designer in Ouagadougou, though, is doing what he can to make up the shortfall. And Kenyans continue to try and find ways around the lockdown of the capital that was brought in earlier this month. Nairobi's been shut to all but essential services since the 6th, and people living in the city are finding it hard going. But first, Africa's seen a 43% surge in the number of reported COVID-19 cases over the last week. Overall, the continent has reported around 26,000 cases with around 1,200 deaths. That's small within the global picture, but the climb does add urgency to the World Health Organization's warnings that the continent could become the next epicenter for coronavirus infections. Africa was one of the last continents to be hit by the pandemic. The Africa Centers for Disease Control and Prevention has said that it is crucial that testing and tracing is ramped up. So far, fewer than 500,000 tests have been carried out on a continental population of around 1.3 billion. The goal is to carry out about 10 million screenings over the next 4 months. On Thursday, South Africa's president spoke to the nation, saying that the lockdown brought in earlier would be eased after April the 30th. But Cyril Ramaphosa insisted that the restriction of movement will remain a priority. The continent has moved quickly to bring in measures to curb the virus's spread. But there is skepticism about Madagascar's move to hand out a herbal so-called miracle cure for coronavirus. Soldiers have been doling the brew out door to door on the orders of the president. Gael Borgia joins us now with more. Gael, why is this being officially endorsed and what's it supposed to do?
It was launched 2 days ago by Madagascar's president. So according to him, drinking 2 bottles of this remedy, it's a herbal tea, basically, 2 bottles of this remedy every day for 7 days is enough to cure you from COVID-19, according to Madagascar's president. The Madagascar Institute of Applied Research, or IMRA, works on this remedy, which is called COVID Organics, with the presidency. And according to the Institute, its first clinical observations were that the remedy cured 2 patients of coronavirus COVID-19. It's not been tested internationally, and the claims of the IMRA are difficult to prove. The National Academy of Medicine of Madagascar has said that it is a drug whose evidence has not yet been elucidated and could harm the health of the population. There are no scientific publications on the brew's effectiveness, and clinical tests in Madagascar are still reportedly underway. So the director of IMRA says that clinical tests take time because of the ethical process of finding volunteers. The country is under a state of health emergency at the moment, and the presidency didn't want to wait any longer for more solid evidence before distributing the herbal mix to the country. Some are wondering what's behind the rush, as Madagascar still has a low coronavirus case count and has not suffered any fatalities from the virus yet. So there is very little transparency and information about the COVID organics. We don't know exactly what's in it, but authorities said that it contains Artemisia, a herbal medicine originally from China that is used in Africa to treat malaria. But using Artemisia in this way is strongly discouraged by the WHO because it has not been proven to be an effective treatment for malaria. And mainstream scientists are warning against the use of untested remedies for coronavirus. So here it's still a serious controversy in Madagascar.
Thanks very much, Gael Borgia, there for us. Meanwhile, Sudan is bracing for an uphill battle should coronavirus infections there spike. With 163 cases and 13 deaths, the number of infections in the country is still small. But the fledgling government inherited a country struggling with corruption, poor infrastructure, and a virtually non-existent health system. It has been less than a year since the Sovereign Council took charge of the country following the overthrow of Omar al-Bashir.
Disinfecting medical centres where possible and stocking up on the scarce medical supplies available. Sudan is preparing as best it can for a possible spread of the coronavirus pandemic. To date, the East African country has recorded 132 cases, whilst 13 people have died. The Health Ministry have said that the country would not be equipped to deal with a full-scale outbreak.
الجائحة بتاعت الكورونا اللي أصابت العالم دي جاءت على خلفية بتاعت تقريبا 4-5 شهور أو 6 شهور من استلام الحكومة المدنية الانتقالية للسلطة في السودان ومجيئنا نحن في سبتمبر. الخلفية دي يعني لقينا فيها نظام صحي منهار تماما.
Sudan only has a few hundred ventilators available and international aid has been slow to arrive. The government have reported a 200% health budget increase since they came to power, but there are still many shortages. Doctors at the moment say they can cope, but they fear that an exponential growth of the virus, like in other parts of the world, would collapse the health system.
هتبقى مشكلة كبيرة لأنه البنية التحتية تعبانة، الكادر الصحي يعاني من إشكالات كثيرة. التثقيف والتوعية هي حيتصدى الأول واللي هي حتساهم بشكل كبير في الحد من انتشار فيروس كورونا.
Sudan's capital, Khartoum, which has seen the most cases and deaths, is currently in a 3-week lockdown. But some experts believe that only a fraction of those infected have been tested.
South African Airways faces a choice of either liquidation or winding down. The state-owned airlines run out of money, and business specialists brought in to try and figure out a way to save SAA say it's also run out of options. It's not turned a profit since 2011 and has had more than $8 billion in state bailouts pumped into it over the last 3 years alone. Face masks will be obligatory in Burkina Faso from the 27th, but they're still hard to come by, even for medical staff. One designer in Ouagadougou, though, is doing what he can to ease the shortfall.
Every morning, Sebastian Bazemo, a fashion designer in Ouagadougou, opens up his tailor's workshop. But since the start of the global health pandemic, his designs have drastically changed. He switched from making dresses and suits to making cloth masks. It's his way of doing his bit to stop the spread of the disease, he says.
Ever since COVID-19 arrived in Burkina Faso, everything has stopped. Not just for us fashion designers, but across all industries. We've been partially laid off, and so our goal has been to use this downtime to help. How? By making masks.
Bazemze's masks, as they've become known in Burkina Faso, are made from coco dunda, a local fabric. They are washable and reusable, which makes them more affordable, especially for those most at risk. But they're also made in accordance with strict health standards.
We've been working with the Ministry of Health to see how we can make masks that meet health standards. We use 3 different layers of fabric. We've taken samples to hospitals for approval. Wearing a mask isn't just a trend, it's something that can protect you.
Bazemze has donated 28 gowns and 100 masks to the medical staff at the Zaktuli clinic in Ouagadougou, valuable equipment during the health crisis.
Ce que nous avions, c'est du matériel à usage unique qui vraiment ne pouvait pas vraiment nous permettre de contribuer et prendre efficacement nos malades. Chacun se battait de son côté, on faisait de notre mieux. Mais ça va beaucoup changer. Encore plus que chacun aura son masque lavable et saura bien en tout cas l'entretenir pour une utilisation multiple. Et cela vient vraiment à point nommé.
From April 27th, it will become mandatory to wear a mask throughout the country. Many Burkinabés didn't wait for the measure to come into effect and have already started donning protective face masks.
Well, Nairobi's been on lockdown since April the 6th. It is no longer possible to come in from abroad. International flights and internal flights have been suspended, trains have been stopped, and police checks have been set up all along the roads into the Kenyan capital. Our correspondents report.
All vehicles leaving Nairobi are now stopped, and travellers must prove the necessity of their trip.
So this one cannot proceed because it doesn't have any document.
The authorities must issue a permit to those who want to leave the capital.
I'm going to Western, going for the burial. Okay. It's one of one member of my church. As you can see, we are safe and we have followed the government instructions.
The police are suspicious. A few days ago, 8 passengers in a minibus transported an empty coffin nearly 300 kilometres from Nairobi, pretending to be leaving for a funeral. Upon arrival, the driver tested positive for coronavirus. Outside of Nairobi, activity is slowing down. Merchants rely on travellers for business.
We're not getting plenty of customers. We have no people coming from Nairobi. People are just stagnant here. There are some products in my shop I do fetch from Nairobi. Now I can't be able to go.
Some still try to reach the capital to get their supplies. This motorcycle taxi driver uses roundabout routes to get his customers from one side of the roadblock to the other.
Police are like 200 meters there.
Working like this is a public health risk, but the driver says it's one he's willing to take.
It is very risky, but the source of income, we are just trying to find source of income.
The travel ban is scheduled to last until April 27, but if the number of COVID-19 cases continues to climb, the measures could be extended.
And a South African dance hit from 1967 is being remixed to raise awareness about the risks of coronavirus. Called Pata Pata, the original was sung by the late Grammy-winning singer Miriam Makeba. But the updated version has been rewritten and is being released by Beninese superstar Angelique Kidjo. It's currently on the airwaves across Africa, and we'll leave you with the sound of Pata Pata. Thanks for joining us. Do so again.
Keep your distance, please.